Chronic disease is a condition that is not going to go away within a time frame, say 6 months. So meaning that probably the patient is going to live with a condition that is going to affect him or her for the long time. It is a very complex care because the clients and the patients who go through our program, they seldom have just 2 or 3 problems. And in fact, many of them, they have a combination of maybe even more than 1 or 2 chronic disease together with other diseases as well.
We have a program offered here that is a chronic disease self-management workshop. The workshop is very interactive. It's 6 weeks long, and people come together for 6 weeks to really learn how to take control and manage the areas of their chronic condition that they can manage. Every week, we all, including the facilitators, set goals for ourselves or action plans that we can achieve successfully. And really what it does is it allows people to sort of develop a record of achievement over the 6 weeks. And when they look back and see all the things that they've done, that's really powerful. It doesn't have to be anything necessarily even related to health. It could be, I just want to clean out my drawers this week, because you want to be able to get people moving towards meeting things that they want to do. And then once they do that, they're likely to then extend that into managing their health.
In the day hospital, in all the patients that actually go through our program, we have the entire team working with them, but by the time they're to leave the program after 3 months, then we have recreational assistant as well as a recreational therapist to help them do what we call linking. It's try to link them from this program, which is a fairly high-level multidisciplinary program, to a program that is available in the community. Because these patients are going to have to live with the condition on a long-term basis, it is most important to get them motivated to be part of their monitoring as well as management of the disease.
We invite caregivers to come along as long as they're willing to be a participant in the program. So they actually have to have their own, they're not speaking just on behalf of who they're with, but they actually are a participant. And we encourage that because we do find that whatever they take away or learn in the program, they're likely to reinforce for each other.
The idea is that for family as well as all the healthcare professionals is to think about the person as a whole. And I think it's always important, particularly in the seniors, always to look at the big picture, be holistic. We are seldom just looking into one problem. We are not looking after one problem, but we are actually looking after a living, real person. And so the most important thing, I think, is for us to be able to focus on the entire person. When we talk about the health, it is not just one part of the body that we have to look after. It's actually the entire person. It can be from brain to your heart, to your lung, to your kidneys, and that's important.